Hello everyone, my name is Dr. Vijay Bhatia. I work in the mental health. Today we are going to discuss about multiple personality disorder. Who am I? This sometimes happens in multiple personality disorder, and each person will take, the same individual will take different personalities. Multiple personality disorder is part of the dissociative or conversion disorder. In dissociative conversion disorder, which is much wider umbrella term, it includes a number of other conversion or dissociative disorders, and multiple personality can happen in dissociative or will happen in dissociative or conversion disorders. The common theme that are shared by dissociative disorders or conversion disorders are a partial or complete loss of the normal integration between memories of the past, awareness of identity, immediate sensations, and control of bodily movements. They are presumed to be psychogenic in origin, being associated closely in time with traumatic events, insoluble and intolerable problems, or disturbed relationships. So what are we talking about is, let's say this person A presents to us and she tells me my name is Tina, and the person they came with, they said, no, your name is not Tina, you are Meena. Now this person insists that they are Tina, and on the other hand, I have seen her before and I know that she's Tina, but now she's calling herself Meena, or the other way. Now this is the same person talking about a different name. They have taken a different identity and they are not aware of their previous identity. They don't have any memory of the previous identity. However, for whatever, when they are in this identity, in this personality, they will remember each and everything at this time or within that period of time, and they will not have any memories of the other person. So there is loss of integration between memories of the past. There is loss of awareness of identity. So this person might call themselves different name, and even they behave differently, they talk differently, their bodily movements control are different. So the same person may come to me with a limp or with some kind of paralysis of arm or leg, and when you explore everything medically, there is nothing wrong, and it seems that the person is pretending to have some kind of paralysis of the arm or leg, but biologically or medically there is nothing wrong, even if you do extensive investigations. And this person has taken a different person's identity. And when you explore a little bit more into the psychological trauma, there seems to be some kind of problems with the psychological emotional distress, which may have happened long time ago, but normally it's traceable to even uh, uh, to recent events, like somebody is having disturbed relationships for some time, and now this person suddenly starts behaving in a different way, where they will lose the memories of the person before they were and what they are now. They will, however, remember some of the things happening, memories for this personality. And if they switch back to the other person, or they switch back to a different person, they will lose the memories of this identity and will continue to have the memories for the other one. In multiple personality, two or more distinct personalities exist within the individual. So it is the same individual. They have one, two, three, or two or more personalities, and sometimes they can be tens of them. Normally can be up to 20, 25, or even more. And so two or more distinct, they are very different from the person they are present. So this is person A, this is person B, this is person C. They are very different. Their distinct personalities exist within the same individual, only one being evident at the time. So this personality may be shouting, screaming, this might be very shy person, this person may be not even looking at you. So they all have different personalities. Each personality has its own memories, preferences, and even behavior patterns, and at some time and recurrently takes full control of the individual's behavior. So what happens if this person B takes over the personality of C? The person C's personality will completely take over, and it is hard to distinguish is it the same person or not. There is inability to recall important personal information, which is too extensive to be explained by ordinary forgetfulness. So this person is telling their different name, different address. And if you look at that, it is very difficult. You cannot explain that person can forget all this stuff in a couple of days or in short period of time. So that's why psychological, emotional factors are playing a role because of the sudden nature and the personality change. The symptoms are not due to organic mental disorders. So there is no underlying mental disorders which are caused by organic lesions like stroke, epilepsy, or taking any psychoactive substances, especially like LSD, amphetamines, cocaine. So either with the substance take, use, or even when you are having the withdrawal symptoms, when you are not taking this, when you have used so much of them and now you are having withdrawal symptoms. So there shouldn't be any of these factors playing up. As we said already, there is now in this case, let's say this is the person who is presenting to you, and you think that this person, the observer, believes that is getting confused with who is this person, because this person is telling a different story, different name, different address. And in the past you might have seen him or her and their identity was different, and at this point of time this person is only aware of this identity. They are not aware of the past identity, and this can happen with different times with the different identities. And sometimes they may lose, even they have this immediate sensations, and they may be very different from this person's identity. And even the control of movement, sometimes the impulsive, the drug taking behavior or the use of drug, if this person identity never used any drugs and this person is using drugs, so you feel, how come these are two different people? So that's where the observer or the interviewer or the psychiatrist or the doctor gets confused. And even sometimes close family members don't understand what is happening. So multiple personalities, we discussed this before. Person A is there, and same person A is behaving in a different way. Something like somebody, they are saying that they are person B, and the same person in a different time may present as a different person as different C. And all these people, person A has different personality, person B has different personality, person C has different personality, and this personality at one point can remember only things about this personality but not much about this personality. However, sometimes they are slightly, because they can be uh, partial uh, amnesia or forgetfulness. So they may remember certain bits of the other one, but normally they will say, oh no, I'm a different person. But sometimes they say that I can change or into a different person, and that person, what they did was not the right thing, or they wouldn't have done the same thing if they were that person. Person A, as we said, that does not have the memories of person B. And like we are giving example again, that person A may have a limp walking, and person AB might be just sitting quiet, and person C might be loud and disruptive, and etc. However, this is the same person. One person is behaving and taking different personalities in different time factors. Here I've given some examples, like each person can look different, can do different jobs, and can have different visions and do different things. However, we are normally aware of ourselves, our past, our future, or which identities I have taken or which roles I have taken. But in in personality disorder, especially multiple personality, the person might take different personalities, not being aware of the other person's personality or the person they were before. So this can happen, and it can happen multiple times, sometimes commonly more than even 20 times in one person. If you like this video, please press the like button and share with your friends. Subscribe the channel for more videos on mental disorders, and especially there is a whole length video on the dissociative disorders, explaining in more details when person might go into convulsions, or there's amnesia, or there is motor activities and other problems. I will see you again.